We thought we'd put together and demonstrate a little slide presentation to go over some of the major issues regarding this vaccine, and hopefully to give you some idea about what we feel are the important topics in relation to giving this vaccine to the 5 to 11-year-old group. The bottom line from all three of us is that this is a vaccine that is extremely safe and extremely effective. And during the time of a pandemic, we really think that this is essential for all of our children between 5 and 11 to now start to catch up to the rest of Canadian society to get protected and to get covered against bad effects from this virus. So let's go to the next slide, David. So this is something that's really important, that we cover children of all ages, and it's now great that we can finally offer this to children that are younger than the 12-year-olds. So both the American Pediatric Society, Canadian Pediatric Society, Health Canada, the CDC, and in Canada, our National Advisory Committee on Immunizations, all of these groups are strongly recommending this vaccine. They've gone through the data. They feel that this vaccine is going to help children and protect them from COVID-19 and get ourselves and our lives all back to normal quicker. We've used vaccines in children for many, many years. And it's funny how parents hardly ever ask me about vaccines that I give to 2-month-olds and 7-year-olds, but there's all sorts of questions about this vaccine. And it's really important to know that this vaccine really isn't all that much different from other vaccines in the way that it works. So we think it's really important that you act as advocates for your children and feel confident in getting your children signed up to get the COVID vaccine, and to do it as soon as possible, because we are heading into, yet again, one of the most dangerous times in terms of the transmission of viruses in our community. The cold weather makes us all stay inside, and this puts everybody's risks up. So we're here to give you answers and the facts, and we're happy to answer the questions that you have. Next slide. So we've got lots of tools, and it's amazing how wonderful our kids have been about socially distancing, doing their best to wear their masks at school, keeping their desks apart, eating separately, in their classrooms without going outside and meeting with other friends. Teachers do their best, custodians, all the school staff, but none of this, mask wearing, none of these things comes close to the protection that you can get from a vaccine. We know that this vaccine is providing good protection once the two doses are done in well over 90% of children that receive it. And that is way better than many of the regular vaccines that I give to children in this age group. So it's really incredible. And this is the mRNA technology that has made this vaccine so much more effective. And so this is really the tool that we need to use, and this is going to be the game changer in getting our children safe and protected and back to their normal lives. Go ahead, David. Lots of people are worried. And I hear this a lot. I mean, this was too fast. It was done too quickly. The truth is that the entire world vaccine culture turned everything else off except COVID vaccine production and lab work. And they use the same processes they've used for making vaccines before. They look for a specific target. They try to find that target and put it into our bodies in a way that it would never infect us. And our bodies recognize that target and build antibodies against it. And as soon as the body sees the real thing, it recognizes it and can mount a quick response to kill it before it causes us any damage. This is no different from any vaccine that's ever been produced. But not only that, these studies have gone ahead very quickly because there's been lots of people who volunteer, particularly in children. It's not easy to get for vaccine companies to get people to volunteer to sign up to take a vaccine. But in this case, there were lots of people who are willing to sign up. And so it made it very easy and very quick to go through the usual steps to make sure that these were safe. And there were thousands of children in this age group tested. And we found the same results that we did with the adult tests, or even better. The immune systems of children work better. We found we could use a lower dose and still get a really good immune response. And so there's really been no skip steps. It still had to go through all the really rigorous checking through both the Health Canada group and through the states, through the FDA. When they go through any other vaccine, it was the same steps. It's just that this was given a priority, and therefore they didn't have to wait behind any other vaccines that were in line to be tested. Next step. So we're confident that this vaccine has the safety profile that we can feel confident in giving this to our children. As I've said before, these have all been reviewed and approved by Health Canada. We've got a 91% protective rate based on the antibody response. This vaccine has been used more than many other vaccines that we give. 7.5 billion doses have been given to people worldwide. And because the States is about 3 or 4 weeks ahead of us in terms of when their vaccine was approved, we already have close to 3 million children in the States in this age group already vaccinated. They have a very robust adverse events community looking for physicians and nurse practitioners to send in any unusual events. It's how we found the issue with the heart problems in the older teenagers and young men. And so far, we haven't seen any of these same issues using the schedule recommended for this 5 to 11 group, which is really reassuring. And when you do get side effects from this, what we're seeing are, you can go ahead, David, the typical things, just like any other vaccine. You almost always get pain, redness, and swelling. And that's actually part of the vaccine tricking the body to make sure that the body pays attention to that part of the body that we've given the vaccine into, so that it actually sends the right cells there to recognize what the problem is. And then that basically trips the entire cascade of our immune system to work properly for the vaccine. There are kids that will become tired for the next 24 hours. Some will complain of headaches, muscle pains, chills, some fever, some nausea. Almost always these can be alleviated by using medications like acetaminophen or ibuprofen, Tylenol and Advil. And most of these side effects are going to disappear within 24, 48 hours at the most. And they shouldn't be something that you would worry about for the next vaccine. It may be a little bit stronger in terms of the next dose, but these side effects are mild and temporary and do not mean that the child has become sick with COVID. And so why should children get the vaccine? You know, I'm a pediatrician and we don't luckily have a lot of children entering into our hospital with severe COVID symptoms. It's not to say there haven't been any. There are some children who can get very sick from this vaccine, and there's some specific medical problems with COVID-19 in children that don't happen in adults that can also be quite frightening in terms of the severity of their effects on the entire body from getting the COVID virus, not the vaccine, but the virus. The next slide, David. So there's a bit of a busy slide here, but these are some of the things that we worry about as pediatricians. We find that when children do get sick, they may not be as sick as adults, but there have been children who've been put in the ICU. There have been children who've passed away directly as a result of this virus, and that's something we can avoid. We have to remember that many of the things we vaccinate against, tetanus and so forth, aren't putting kids into hospital or aren't putting them into ICUs, and yet we still routinely vaccinate against those to make sure that even the rarest of things that could threaten our kids we want them protected against. And it's no difference than with COVID. And, you know, to be honest, our schools and so forth are flooded with this virus, and it really is a matter of time before your child will pick it up, or if they haven't already. This MISC is a very frightening episode. I've seen several children in Scarborough come down with MISC. It's a very acute or very sudden inflammatory response that can affect almost every organ in the body and causes a dysfunction of those organs. Thankfully, it's usually for a short time, and most of these kids have recovered nicely, but this is one of those syndromes that if it changes over time, we could have a lot more children with severe mortality or morbidity from this one. Long COVID, we know long COVID can happen in adults. It's a little bit less frequent in children. Children sometimes may not be complaining of the same symptoms, and sometimes as parents, we think of, you know, low energy, fatigue, you know, not being hungry. These aren't necessarily easy symptoms to pick up in children. And so there may be way more children with long COVID symptoms who are not recognizing. But certainly this is something we can avoid by vaccination. And then finally, the children that do end up in hospital don't all have morbidities or things that could make them sick. We know that kids who are on ventilators at home, kids who have severe respiratory problems, kids who are quite overweight or have diabetes or any immune conditions, any neuromuscular conditions. These are definitely children who are at risk for more serious complications from COVID, but there's also a lot of kids who are perfectly healthy who end up in hospital or being quite sick from this virus. So because we can't pick them out, we need to make sure that we cover not just the children that are at risk, but all the children. At this point, I'm going to turn things over to my very esteemed colleague, Dr. Rena Levinsky, who will continue on with our talk. And we'll take questions later. Thanks very much.
Thanks, Peter. So my name's Dr. Rena Levinsky. I'm an adult infectious disease specialist. I do have children of my own who have been vaccinated. They're a bit older. And I just want to continue on with what Dr. Azzopardi was saying. I think as a parent, when you're thinking about vaccinating your children, it really is a decision of hope and a decision to make sure that your children can recapture the joys and freedoms of childhood. Right now, we're all anxious about sending our kids to after-school activities. They have to go to school in masks, they're in cohorts. We can't think about changing public health measures in schools until everyone in school is vaccinated. And the goal of vaccination is to decrease that anxiety for both parents and for children, for them once again to recapture the joys of their usual life. That includes school. Next slide, please. When we talk about vaccinating children, a lot of parents think that the reason they have to vaccinate their children is to protect society. It's really, as Dr. Azzopardi mentioned, it's to protect them. We want to keep them healthy. And by protecting your children with the COVID vaccine, you're protecting your youngest children. So children under the age of 5 are not yet eligible for vaccines. There's added protection if their older siblings are vaccinated. And older adults have waning immunity. So we know over time that people who were vaccinated earlier this year have less protection against mild disease, still very good protection against severe disease. But if people in your family have low immune systems, if they're on chemotherapy, we want to really make sure there's a circle of people who are protected around them. And that includes your children who are ages 5 to 11. Next slide, please. And I think what we're hoping to do tonight is help you make that risk-benefit analysis. And this is what parents are struggling with. You know that the risk that your own personal child will have severe COVID is likely low. You probably don't know anyone who has a child who is admitted to hospital. And the chance of your child getting that multi-inflammatory syndrome that Dr. Azzopardi talked about is 1 in 3,000 if they get COVID. So that might also be low. But the chance that your child is going to have a negative effect from the COVID vaccine is way lower than all of these risks. And we know that the pandemic is still going on. We know Ontario numbers are going up, but we also know that numbers in Europe are very high and continuing to increase. So this disease is going to be around for a very long time. So it is highly likely, if not inevitable, that your child will be exposed to COVID. And now is the time to protect them. So if we don't vaccinate our kids, that's also a risk. It's a decision that is with risk because your child will be exposed to COVID and then will be at risk of disease. But what we're here today to do is answer your questions so you can make that decision yourself. But it doesn't just end today. You should speak to a trusted healthcare provider. You do not need to make this decision alone. This is a decision you should be making with an expert. And that's some of the information we'll give you tonight, but it doesn't have to end tonight, the discussion. You should feel free to speak to your pediatrician, your pharmacist, or any healthcare provider that you trust. Next slide, please. And as Dr. Azzopardi mentioned, this is a slide from the CDC. This was information from last week, that as of last week, almost 2 million children had already been vaccinated in the States. And they have a great working group and an app in the States for doctors and patients and parents and nurses to update the CDC with any adverse events from the vaccine. And they haven't seen any safety signals yet in this age group with almost 2 million children being vaccinated as of last Friday. Next slide, please. But I'm sure you have lots of questions. So we're going to answer a few upfront and then open the floor to questions from our audience. Next slide, please. So I think one of the biggest questions we get as physicians is what about the effect on our children's bodies, on our own bodies, if we're going to get the COVID vaccine? Can it change our DNA? Can it have long-term side effects? So as Dr. Azzopardi mentioned, although these vaccines are new, the technology, mRNA technology, has been around for decades. And vaccines have been around for decades. And when we vaccinate our children, we're making them develop antibodies, which are like little soldiers that stay on hand, that if they get exposed to the virus that causes COVID, the soldiers are there to kill the virus before it causes any damage and any infection. It's preventative. The only thing that stays in your body after a vaccination are those antibodies, which are natural antibodies. They're part of your body. You make antibodies all the time when you get exposed to infection. The mRNA vaccine has a recipe. That recipe goes inside your body. It does not enter the nucleus. It can't alter your DNA. And that recipe allows our body to make a protein. That protein is an exact replica of something on the virus that causes COVID. And then our body makes those soldiers, those antibodies. And that recipe disappears from our body. It doesn't stay. There's nothing left from the vaccine in our bodies that could cause any long-term damage. All that's left is our natural antibodies, our own immune system to keep us protected. Next slide, please. So a lot of people worry about long-term side effects. You're making this decision for your children. You want to keep them healthy. You want to protect them from COVID. What you don't want to do is cause any long-term problems. What we know about the vaccines is they have a long-term protective effect, so that for adults, even 8 months post-vaccination, they're highly protected against severe disease and hospitalization. That's the best thing that happens long-term. We have no vaccines that cause problems with puberty or fertility, and there's no evidence that COVID vaccines will affect your child's puberty or fertility. And we know that these vaccines are actually going to keep our kids healthy and healthy for the long run. Next slide, please. I'm just going to take a break here and pass the mic on to Dr. Latif Murji. Dr. Murji is the physician lead for our VaxFacts clinic, and we'll just continue to add some more facts for you about the COVID vaccines. Dr. Murji?
Thanks, Dr. Levinsky. So as Dr. Levinsky mentioned, I run the VaxFacts clinic, and we're going to talk a bit about that later on. First, I want to just mention heart inflammation. So some people have heard of this thing called myocarditis or pericarditis. And this is where part of your heart muscle has some inflammation. So this is actually slightly increased with the vaccine. However, there's a lot of points to understand about this. And the first one is that you're taking the vaccine to prevent COVID, and COVID is known to cause myocarditis as well at a much higher rate. As you can see, you're at 16 times higher risk of myocarditis with COVID-19. And I have a picture of this Edmonton Oilers hockey player in the bottom left. His name's Josh Archibald, and he's the only guy on the whole team who didn't get vaccinated. And turns out he got myocarditis. As you can see, that's the tweet right there. His career is indefinitely suspended because he can't play with that condition. So one additional reason to get vaccinated is to prevent COVID and the downstream effects of COVID, which include myocarditis, amongst many other things. In terms of some numbers, there's this number of 1 in 26,000. That's actually the incidence of myocarditis with the Pfizer vaccine in adolescents, and it's mostly 16 to 29-year-olds and males that have that. We know that myocarditis is actually associated with testosterone, and for this reason, we actually don't expect there to be nearly as high a level of myocarditis with the pediatric vaccine for 5 to 11-year-olds, because all of 5 to 11-year-olds have not undergone puberty, so their testosterone levels, whether they're male or female, are much, much different than a 16 to 19-year-old. And even if you are 16 to 19-year-old, it's still worth it to get vaccinated, as I mentioned, because of preventing COVID and myocarditis. And an additional point, one more, is just that it turns out that vaccine-associated myocarditis is actually much milder than regular myocarditis. So what we've seen is that small percentage of people who did have myocarditis from the vaccine, who are, like in their late teens, males, they actually, most of them, a large majority of them, made a full recovery and didn't even need to stay in hospital for one night. Next slide, please. Should I wait just a little longer? The answer is no. We know now that this vaccine is very safe. There's been a lot of studies done on this, including with pediatric populations. And again, just like Dr. Levinsky mentioned, the benefits of the vaccine are much, much larger than the risks. So waiting is actually a risk. Because the interval between shot 1 and 2 is 8 weeks, that means it takes 10 weeks for full immunity to develop. And we know that the holidays are coming. There's going to be more gatherings because of the winter. We're not going to be able to be outdoors as much. So it's really important that we get all of our kids vaccinated so that they can all keep each other safe and keep everyone else safe as well. The vaccines make our schools safer. Okay, so we want to get at least the first dose done before the holiday season starts. Next slide, please. Can the COVID vaccines be given with other vaccines? So right now, just out of extra caution, we are just going to have a 2-week interval before and after that COVID vaccine dose, just so that we can monitor and see if there's any side effects from the vaccine, then we can actually attribute them to this vaccine. Whereas if we were doing them simultaneously with the flu shot, for example, or other vaccines, then it kind of murkies the waters. So just out of that precaution, we're having the guidance of having no vaccine 2 weeks prior and no vaccine 2 weeks after your child's COVID vaccine. But at the same time, we still encourage flu shots and routine immunizations. All of that is excellent and highly encouraged. Next slide, please. Why is the vaccine dose smaller for kids? Okay, so so just so that we're clear, the dosage is 10 micrograms instead of 30, which is the adult dose. And it's actually common for different age groups to have different dosage for vaccinations. So for example, the hepatitis A vaccine has a higher dose for adults than children. So this is not uncommon. Children have different or more robust and stronger immune responses than adults. So they don't actually need as high a dose to have the same response in terms of creating antibodies. So we found that this 10 microgram dose gives children the same immune response and the same antibody production as adults produce with 30. So it's equivalent, and it actually has less side effects, so it's a bonus. Next slide, please. So here are just a few photos of people in the community who, parents and children who have different reasons for why they got vaccinated. So, generally people want to protect themselves, the children, their communities, and, stay in school so that they can learn and have fun. So this is the way we're going to move past COVID, is by getting everyone vaccinated. Next slide, please. And we just want to say that we totally get that there's a lot of info out there and it's pretty overwhelming. And there's information and there's also misinformation. Hopefully you can see that you have 3 physicians here today, and we thank you for coming out and hearing what we have to say, because you're getting facts from experts here. So we know that you want to keep your children safe, and that's why you're here. So we appreciate that this is very overwhelming and that you want to take your time. And that's why we're here to answer any questions you have. So next slide, please. And that's why we also have, not in addition to this public session, if you want to have a confidential, judgment-free discussion one-on-one with a doctor, we have the VaxFacts clinic. So if you want to make an appointment, we hope you ask your questions today, but if they're not able to be answered today, just go ahead and make an appointment at shn.ca/VaxFacts, and one of our physician experts will have an appointment with you over the phone in a confidential, judgment-free manner to answer any questions you have about the vaccine to make sure you're comfortable with your decision. Thank you. I believe that's the last slide.
Great. Thank you so much, Dr. Azzopardi, Dr. Levinsky, and Dr. Murgy. We do have a lot of questions in our Q&A and in our chat. So we will get to our first question. Our first question is, if my son turns 12 next year, if he takes the first dose this year, is he going to get the full one next year when he's 12 years old, or is he going to get the same amount? In that case, is it better to wait till next year, starting in January, or giving him the first dose now and then the second dose next year?
So I can help answer that one, David. So if the answer is get it as soon as possible. If he's turning 12 this year, he'll get the full dose this year, and his booster dose will be the full dose as well. For kids who are under 12 for this year, they will get the smaller dose, the pediatric dose. And it's still open for kids that are 4. If you're turning 5 by the end of December, you can still get, a 4-year-old can get the pediatric dose as well. If you're 11 and you get the pediatric dose and you turn 12 before the next dose comes around, you get the bigger dose. So, this is confusing. The truth is that the people who are in the clinics will tell you exactly what the dose is. And the answer to when to get it done is as soon as possible. There's no question we're going to see increased numbers of COVID over the next few weeks, particularly over the holiday season. If we can get our kids in soon, we'll definitely give them some level of protection with that first dose.
Thanks, Dr. Azzopardi. The next question we have is, I've heard that the vaccine has caused some women to notice a change in their menstrual cycle. Will the vaccine impact hormonal development? And what data or information is there out there right now on this topic?
So I can take that one. Maybe we can just alternate who answers the question. So I think this is an excellent question. Parents are worried about the long-term side effects. They're worried as their children are turning 11 that, they're close to puberty, they're close to their menstrual cycles. Will it have an effect? So because everyone's looking very closely at the rollout from vaccines, what happens with Health Canada is they look at all the data. They carefully collect the data, review the data, and then they speak to other agencies like the FDA, like the AMA in Europe, and they talk about what the data is. They collaborate, and then they approve the vaccine. And then there's post-vaccine rollout where they actually look at complication side effects after the vaccines have been given. There's no evidence in adults and in the 12 to 17 age group that there's changes in the menstrual cycle or effects on hormones based on the vaccines. Scientifically, it wouldn't make sense. We've all had tons of vaccines. They create antibodies. Antibodies can't affect your hormones or your menstrual cycle, but these things are being looked at. And to date, there's no clear scientific evidence that it affects menstrual cycles, and there's no plausible explanation why it would affect puberty. And physicians, as well as the group tonight, are really recommending these vaccines. We are not concerned about the effect and any effects on puberty or menstrual cycles or hormones.
Thanks. Next question is there a value in waiting longer to see more data as more children are vaccinated globally? You'd mentioned that the sample size used to get the approval and millions are vaccinated in the US. So the question is that enough, and has enough time passed?
Sure, I can take that. Thanks for your question. I would say that enough time has passed already. It is time to get vaccinated. We have a lot of data. We have very rigorous data from the pediatric population that was used to, that Health Canada just took, as Dr. Linsky described, to actually approve where we're at right now. Plus, in addition to that, we have the bonus of the United States just moving faster than us. And because they're such an enormous country, in the past couple of weeks, they've already vaccinated the equivalent of the entire city of Toronto if everyone in Toronto was 6 years old. So we have so much data, and we're monitoring this closely, and we're seeing, as expected, that there are no ill effects of the vaccine and that the vaccine is effective at preventing COVID, 91%. So I would not wait, because waiting is actually risking COVID, and that comes with, a possible acute illness like multi-inflammatory syndrome in children and long haul COVID syndrome. And I would not risk that for my child. So I would say at this point, the benefits far outweigh the risks, and it's time to get vaccinated. Thank you.
Great. And the next question we have is, my son will turn 5 at the end of December. Is there any evidence that my son should wait until he turns 5 to get vaccinated?
Yeah, physiologically, the difference between 4 and 10 months and 5 and 3 months is 0. There is no difference in the way his body's functioning or the way his immune system is functioning. So don't wait. luckily, you can get your child in earlier. He'll turn 5, and then you'll get the next dose in 8 weeks' time, and then he'll mount a full response by that time. So because it takes time to get that full response, we know that we're going to get most of our kids through the holiday season with only a partial protection, even if they were vaccinated today. But partial is way better than none. And that's why we want you to get in there and get going as soon as possible. It's a good question.
Thank you. And our next question is, my son has Wolff-Parkinson-White syndrome, which leads to rapid heart rates, tachycardia. Is it safe to take the vaccine?
So I'm going to answer that, and then Dr. Azzopardi can add as a pediatrician. So WPW is a cardiac condition, a heart condition, as you've described. So there really is no reason not to take the vaccine if you have WPW. Sometimes kids will get fever after the vaccine, and that can also cause an increased heart rate. So after your child's vaccinated, if they get a fever, it would be a good idea to have Tylenol or Advil on hand so that you can counter-effect the effects of a fever. COVID itself obviously also causes fever, as does other infections. But in general, we recommend the COVID vaccine for kids who have medical conditions. Because if you have any heart or lung condition, you're more at risk of severe COVID, not specifically WPW as far as I know, but in general, kids who have medical conditions, we want them to have that extra layer of protection because they have underlying health issues. We want them to be as safe as possible from this infection. But I'm just going to pass it on to Dr. Azzopardi as our pediatric expert to see if he has any other thoughts.
As usual, Dr. Levinsky, you did an excellent job. I'm going to make you an honorary pediatrician by the end of this talk. But the truth is that any child with any heart condition is at much higher risk from getting severe complications from COVID, and therefore there are no heart conditions that are present in children that would be a contraindication to use this vaccine. The only time we've told people to take a pause and not to get another dose with a heart condition is in those older teenagers and younger men and other people who may have had a myocarditis type reaction from the first dose of their vaccine. And so in those cases, until we get a bit more knowledge about that, we've said, do not give those children and teenagers and young adults another dose. But as Dr. Levinsky said, any child with an underlying heart condition is already at high risk. You're much more protected and safe if you get a vaccine than if you let COVID come into your body and infect your body, your organs, and put your heart at further risk. So I hope that answers that question.
Thanks. And we have actually a follow-up to one of the first questions that we had, just some clarification. So my daughter is 10 years old and she will be 11 in a few weeks. I understand that she will be given the child dose when it is administered. However, she will not turn 12 until December 2022. My question is, if she receives her second shot in February, will she be given the adult dose?
Well, I can quickly jump in there. I seem to be the time guy. So no, if she's 10 now, she'll get the pediatric dose. And when she's, and in 8 weeks, she'll still be either 10 or 11. Those are still the age ranges for the pediatric dose. It's only the kids that are turning 12 between the doses that if you're turning 12, then the second dose would be the adult dose. And this is all based on just an arbitrary, date and age limit, because we didn't, this is how the studies were produced in these age ranges. Young children have a very good immune response to antigens, and that's why a smaller dose is fine. But remember, it's really just the way the studies were designed. It doesn't mean there's any significant change just because your birthday changes.
Thank you. My daughter has a severe allergies to cashews and pistachios. Is it okay for her to get the vaccine? She is 10 years old.
So thank you so much for this question. I'll take it. And I apologize, we didn't make a slide about allergies. So this, pediatric patients have a lot of nut allergies. So I think this is a common question for most parents. And in general, when we even had the rollout for adults, people were asking about allergies. And at the beginning, when we first started rolling out the vaccines, we were worried about allergic reactions, and there was a lot of close monitoring. So what we found is actually that people with food allergies do not have an increased risk of an allergic reaction to the COVID vaccines. People with drug allergies actually don't have an increased risk of allergic reactions to the COVID vaccines. It's really having the allergies to the components of the vaccine that are most concerning. But as an added layer of precaution, people are watched for 15 minutes after their vaccine to ensure that they don't have an allergic reaction. Usually in adults, severe allergic reactions happen within first 15 minutes, but sometimes within the first 30. So if you're very anxious about your child having a severe reaction, even though the risk is not increased based on a peanut allergy, you can ask for your child to be watched for half an hour after their vaccine is administered. And in all of our vaccine clinics, there are physicians on hand, and there's a protocol if anyone develops an allergic reaction. So when I got my vaccine, there was an ear, nose, and throat specialist and an anesthetist in the different times I was vaccinated. So there is a physician there who knows how to deal with allergic reactions. But for someone with a food allergy, with a skin allergy, even with medication allergy, these vaccines are safe and there's no increased risk of anaphylaxis with those allergies. The risk of anaphylaxis with Pfizer was really seen to be about 1 in a million to 0.1 in a million over time. The rates got less as we kept observing and more vaccines were given. So very overall risk, low risk of allergic reaction that's severe and no increase for your child with a peanut allergy.
Thanks. Maybe to piggyback on that one, there's a question. It's from a father of 2 children, 9-year-old girl and a 7-year-old boy. The question is with regards to the boy who was born with a cleft lip and has only 1 kidney. What are the effects that he could have if he gets vaccinated? Or better, is it advisable to give him the vaccine?
Again, maybe I'll take this one again. There are really no medical conditions that would prevent you from giving your child this vaccine, unless your child is, undergoing some severe treatment like chemotherapy, in which case, that's an immune system medication. You need to speak to your doctors about that. But for this particular example, cleft lip and cleft palate, a kidney problem, there's definitely no reason to wait. There's no contraindication to this vaccine. And, we've given this vaccine to older people with these conditions with no problems, and we don't anticipate that to be a problem in younger children as well, the same way we would do for other vaccines for children. There's no added risk. If you have any questions about any particular medical issues, feel free to reach out to your pediatrician, your family doctor, your specialist, or call our VaxFacts clinic and speak to one of our doctors directly.
Thank you. If my child has a runny nose or a cold, can they get the vaccine?
Well, again, I'll jump in there. So the real answer is yes. Your immune system's fighting off thousands of little things all the time, whether it's something that you took in as a food or something you've breathed in as a particle that may be triggering your immune system. So our immune systems are always on and fighting and are capable of handling lots of antigens all at the same time. If you wait, particularly this fall, where we're seeing lots of kids with runny noses, if you try to wait to the time when your child is just perfectly healthy, you'll never end up getting this vaccine. So if your child, I always tell parents this, and this is true for any vaccine, if your child is running with a high fever and feeling really unwell, then for sure, wait till the fever's gone. But if it's just a tickled throat or a runny nose, there's no reason not to get the vaccine.
Thanks. Next question that we have is, when do you expect the vaccine to be available for under 5?
So I can take that one. Excellent question. Lots of you on the line have children that are under 5 and are anxious to get your younger children vaccinated. We have been told that the studies in younger children will be complete by the end of the last quarter of 2021, which is slowly approaching. That would be by the end of this year. And then once the study is complete, the information would be shared with Health Canada and with the FDA and the EMA, and then it would need approval. So the hope is that early next year, we will be able to roll out vaccines for younger children. But obviously, all the research has to be done. Often some of the research is given to Health Canada before it's fully complete, so they can start reviewing the data. So the hope is early next year, we'll be able to vaccinate even our youngest children.
Thanks. How is myocarditis treated? And do we know what the recovery rate is for myocarditis for people that get it after COVID, people that get it after the vaccine?
So I'm going to take that one as well, just because myocarditis is more common in adults. And in general, myocarditis is the most common in 17 to 30-year-olds. In general, myocarditis is caused by viral infections, just like COVID. And when you have a viral infection of your heart gets damaged. So from COVID, then you're actually restricted from activity, sometimes for 6 months, sometimes for a year, as your heart recovers. There was studies in children looking at the difference between COVID from myocarditis from COVID. There's also myocarditis related to inflammation with MIS-C. So that inflammatory syndrome that Dr. Azzopardi talked about, you can get heart inflammation from that. And then there's the myocarditis related to vaccines. So as Dr. Murgy mentioned, we don't even know if this will be an issue in this young age group because they're the least likely to get myocarditis in general. In adults and youth who have gotten myocarditis with the vaccine, it's really very mild in general and short-lived. It's usually 4 days after the second dose. So in Ontario and in Canada, we're giving children doses 8 weeks apart. In the US, they're giving their doses 3 weeks apart. So there will be lots of data on second doses and risk of myocarditis before your children are even eligible for the second dose. There was myocarditis seen with smallpox vaccine. Occasional cases have been seen with flu vaccine. And the way it works with vaccines is more of a temporary inflammatory response. There's no virus infecting your heart. So the disease is usually mild and usually gets better. Some cardiologists give anti-inflammatories at the time. So if after the second dose, your child has chest pain or palpitations or pain when they breathe in, that would be when you would seek medical attention. But we're hoping this risk is not a risk in this age group. There haven't been any cases reported in the States with the millions of kids who have already been vaccinated. But we know for sure that the myocarditis related to COVID has worse outcomes in children. And then at least compared in youth, 12 to 17-year-old, the myocarditis with vaccines is much more mild.
Next question we have is, how can we get our kids vaccinated in Scarborough, and can parents choose the brand of vaccine?
So I'll jump in, I guess. So I don't think you can't choose the brand of vaccine at this point, because at this point we only have Pfizer that's been approved for children. So there is no other choice for this age group at this point. We may see Moderna's vaccine being approved soon for the same age group. They've done a 6 to 11-year-old study. So that at the moment there's no choice. If you go to scarbvaccine.ca, and David, maybe you can throw that up into the chat. That website is a very good website to look at all of the Scarborough Hospital run clinics, and these are running from our fixed clinics, we call them, at the Birchmount site of our Birchmount Hospital site, at the Centennial College site. We will have pop-up clinics running all through different parts of Scarborough, and we're teaming up with Toronto Public Health and our school board to run a bunch of pop-up clinics based in schools, usually after school, so that it acts as a community hub to try to get this vaccine out as much as possible. You know, Scarborough has done an incredible job of vaccinating the population. And when you look at the number of people that are getting very sick from COVID in Toronto, Scarborough has some of the lowest numbers in the city. And that's all due to good vaccination rates. There's no question that these vaccines are keeping people out of hospital. People, remember, no vaccine is perfect. Even though we vaccinate 100 people, 9 or 10 of those people are still going to be susceptible to getting the vaccine, to getting the virus. But they won't be getting sick enough to end up in our ICUs, and that's really the whole point about this. We can't prevent every infection of COVID-19, but we can do our best to prevent people from ending up in ICUs or dying. You know, I've seen in the chat some questions about specific numbers, so I looked one up. 17 children have died in Canada from COVID-19. That's a very large number when you consider how many kids have died from meningitis, some of the tetanus, polio. You know, these are not small numbers. And if one of those 17 was one of the people you love and know, you know, that would be these are all tragedies, and they're preventable. In many cases, they're preventable, and we really do need to do our best to try to prevent this virus from spreading any farther.
Thanks. Our next question is, if your child has had COVID, will they have natural immunity, or should they still be vaccinated?
So I'll take that one. So what we're recommending is, even for people who've had COVID, to get vaccinated. Studies have shown that when you've had COVID, your immunity usually lasts for 3 to 6 months. So the urgency is not there to get vaccinated right away, but usually we would recommend it's a 3-month mark at the latest to get a booster. Like your vaccine will act as a booster to boost your natural antibodies. So we know from adults, if you had wild type COVID, you're still at risk of new variants getting infected. And when you get your vaccines, it increases your antibody levels, your natural antibodies, even higher to protect you on new variants. And we know this pandemic is continuing worldwide. We know there's going to be new variants. So it is important to still vaccinate your children who've had COVID. You could wait. You should wait until they're not contagious and they're not feeling sick. Obviously, you want them not to be contagious to go to the vaccine clinic. And ideally, you want them feeling well enough so you can tell what side effects are from the vaccine and what's from their COVID, but it's not dangerous to vaccinate them as soon as they're out of quarantine. So it's reasonable to wait 3 months. So you're boosting their natural immunity, but we would definitely still recommend vaccines for people who've had COVID, and that would include children.
Thank you. After being vaccinated, do children need to restrict activities or extreme sports? If so, for how long?
So I can take that one as well. When you get your vaccine, for everybody, the side effects are different for everyone. Usually the side effects start about 12 hours after your vaccine. Because it's an mRNA vaccine, it takes about 12 hours for your body to start building antibodies. And that's when you start to have side effects. So I wouldn't plan anything rigorous for the couple days after their vaccine, just because you don't know how your child's going to feel. So they may have a fever, they may feel tired, they may not be in the mood to do sports. It's not dangerous, but they might not feel up to it. So it's a good idea just to prepare your child that they may feel a bit unwell and not plan too much, especially if they just feel tired and lethargic. It's great to be home in your pajamas, but it's not dangerous to do activities. And obviously, because the vaccine doesn't have the virus in it, they're not contagious. They're totally safe to be around other people, but I would just plan to take it easy.
Can you explain a little bit why the vaccine dosage is based on age and not on weight? My 9.5-year-old twins weigh 55 pounds and 95 pounds each, son and daughter.
Yeah. Again, these were studies that were based on ages, really. That's how they divided the groups in the study. So they did the adults first, and then while they were running the adults, they were also recruiting teenagers, they were recruiting young children. And in fact, we've been doing studies with babies from 6 months and up as well. So those studies are still in process and will be coming to us. So we didn't stratify the studies by weight, and that's why you're seeing it based on an age range. But what we know from other vaccines is we never have to change the dose based on a weight. We do know that kids respond to kids respond better to vaccines, and that's why we've been able to lower the dose. There's very little difference between this vaccine and the adult vaccine. Again, I saw a note in the chat, so I'll answer that one too. There's I believe one added preservative to this vaccine so that the vaccine vials are more stable, and so that the chances that you don't have wastage or spoilage, or that we don't have a vaccine that's potent when it's actually given in somebody's arm, is much better with the pediatric formulation. So again, there's no reason to worry about the weight of the child. And the other thing about these vaccines, I'll just throw it out there, is that these vaccines do not have metals in them. There's no aluminum in them. There's no antibiotics in them. There's no egg or any sort of things like that. These are very stripped down vaccines with mainly the particle that does the business and some salts, fats, and oils to help deliver it to the body. And again, that really boosts their safety profile. It's also why we have to be careful when we're handling these vaccines. And it's why we don't treat them like any other vaccines. They still have to be kept very frozen until we're ready to use them.
Thank you. There's a question here about the COVID-19 clinics that are going to be set up in schools and other places. The question specifically is, will parents be allowed to come into these clinics to accompany their kids while they get their vaccine? Because this parent heard from someone that the school clinics, parents won't be allowed inside. Do we have any information on that?
Sorry, a vaccine? No, we're never going to keep parents outside of a vaccine center. I mean, for this particular age group, we need the consent of the parents to give the vaccine to the child. So that would never happen. And we aren't planning on giving vaccines in school during school times without parents either signing a consent form or being present. So that's, I mean, Toronto Public Health may have their own way of doing it, but certainly for Scarborough Health Network, we're planning to do it with parents present at all times, so that we know that they have consent. You know, as it is, there are kids that are getting vaccines in schools all the time. We all know that when our kids get to grade 7, they get 3 different vaccines given multiple shots, and that's done in school without parents present, but that consent has been granted to the school board to do that.
Thank you. And then next question we have is, for a parent with a child with asthma and allergies, should I be having his pediatrician administer the vaccine in case of a side effect?
Again, the answer to that one is no. Not too many pediatricians are able to do this vaccine in their offices. If you do have one, then that's terrific. Most of our vaccine clinics at Scarborough Health Network will have a pediatrician on staff in the vaccine clinic. So you could always speak to them or ask them questions. But to be honest, any of the doctors that are there are very well versed in what are the potential side effects from the vaccine. Asthma is not a contraindication, or eczema to the vaccine.
Thanks. Next question we have is, my daughter is 7 and she had her second dose of varicella vaccine 3 weeks ago. When can she get her COVID vaccine? Her family physician recommended 6 weeks waiting period. What is your suggestion?
So I can take that one. So at the beginning, when the vaccines first rolled out to adults, NACI had suggested waiting a month after a previous vaccine, just to make sure that there was no side effects between one vaccine and the other, and as an extra precaution. There's lots more information now about the safety of giving vaccines at the same time, but as an extra precaution, NACI is saying to wait 2 weeks after a previous vaccine, just to make sure if your child has side effects from the COVID vaccine, that it's obvious that they're related to the COVID vaccine and not a previous vaccine. So if your child had their varicella immunization 3 weeks ago, according to NACI and the Ministry of Health, you can get the vaccine anytime. 2 weeks would be the most you would need to wait. You definitely don't need to wait 6. And it would be great to get your child vaccinated before the winter holidays, before they're going to be around family and friends. So there's no need to wait any further time than what's already passed.
Thank you. Another good question. How long will the COVID-19 vaccine protect children from getting COVID after receiving the full 2 doses? And will this vaccine turn into something like the yearly flu vaccine?
So I'm going to take that one as well. So we don't know yet if this is going to turn into something like the yearly flu vaccine. We know there's a lot of vaccines that we give 3 doses and people are protected for life. So Hep B is like that, where we get 3 doses and that's all we need. So the hope, it's very possible young children are also going to get boosters, as older people in Ontario getting boosted, likely just like the States, who's starting to boost everyone over 18. It's very likely young children will also get vaccinated again. But nobody knows yet if it's going to be a yearly vaccine. We hope not. I can tell you from the adult data that protection against severe disease has lasted over 157 days. High protection against severe disease, 88% for Pfizer without extended intervals, and 88% to 97% for Moderna. So we know there's great protection in adults for a long time against severe disease. We have seen waning immunity with adults who didn't have intervals of 8 weeks over time. So the reason NACI is suggesting waiting 8 weeks is, with this interval, this is supposed to be the best interval to get the best, longest lasting immune response. So as of today, we don't know if young children are going to need yearly vaccines, but waiting that 8 weeks will provide your children, based on the best evidence, with the highest, best level of antibodies.
Thank you. Next question that we have is it recommended to have the 8-week interval gap between first and second doses for my 13-year-old as well?
The answer to that one is no, you don't have to wait for the 13-year-old. It's still quite okay to go ahead and give it at the routine time for the next dose. I think it's 3 weeks that we're recommending. And to be honest, this particular recommendation of waiting 8 weeks came as a bit of a surprise to the medical community from NACI, because it's not really based on a scientific concern. It's really based on the importance of trying to make sure that anything that may happen after the vaccine is attributed to one vaccine. So if there's a side effect that does show up, there's lots of time to see whether or not that side effect is from the COVID vaccine. And also, just again, as an abundance of caution, because we know kids react so well to this vaccine, they're hoping that by spacing it out, that the kids will still get some protection, and that by spacing it out, that protection will last longer. So we do know that by giving a longer break between the doses, you get a longer dose you get a longer effect from the vaccine. But of course, that's one of the things that we don't know, because those patients haven't gone out long enough to see how those rates are. So again, it's being extraordinarily careful on the point of NACI, and in most cases, doctors in our clinics will follow that. There are some cases where it's important to get the vaccine sooner than 8 weeks, and that may be something that your doctor recommends as well.
Great. And we actually have a couple of questions from people that are just wondering, what are the symptoms of myocarditis?
So I can take that. So I mentioned it briefly earlier. So myocarditis is a heart inflammation. People might have chest pain, which would be unusual for a young child to complain about. So that would be something that would trigger your concern. They can feel pain when they breathe in. Sometimes they can feel their heart beating quickly. Sometimes people with myocarditis can have fever, but it would really be the chest pain or shortness of breath that's out of whatever they've been doing and out of the norm that would trigger concern, and then to see a physician.